Hi everyone, I'm Genevieve Jimenez and the data source I chose was school-based mental health. The actual website was capsonline.org. It's a collaboration between the Association of School Counselors, the California Association of School Psychologists, and the California Association of School Social Workers. It included a joint position statement and collaborative efforts to bring awareness to schools' need for helping professionals with PPS credentials in school counseling, school psychology, and school social work. It also included the impact of rising mental health issues in school achievement. And lastly, it included links to websites with statistical data to support their position. These websites included kidsdata.org, schoolcounselor.org, and cdc.gov. These websites I just listed are my key source for the maps and charts I included in this presentation. The problem statement I identified was inadequate financial support from federal, state, and county governments, which impacts students' access to school-based mental health care, especially for students of color and students from low-income families. 3 key findings. The 3 key findings I identified in the research were mental health issues rising in youth, unmanageable student to helping professional ratio, and shortchanging of students of color and students of low-income families or even both. Mental health issues rising in youth. As you could see from the chart displayed on the side, mental health issues in youth are of growing concern. ADHD, anxiety problems, behavior problems, and depression are the most commonly diagnosed mental disorders in children. According to the Centers for Disease Control and Prevention, without early diagnosis and treatments, children with mental disorders can have long-lasting problems. Early diagnosis and appropriate services for children and their families can make a difference in the lives of children with mental disorders. Unmanageable student to helping professional ratio. In the chart displayed on the side, student to staff ratios are shown. The recommended student to staff ratios for counselor are 250 to 1, for nurse 750 to 1, psychologist 700 to 1, and social worker 250 to 1. The national student to staff ratios almost double in counselor from 250 to 444 to 1. Nurse also increases to 936 to 1. Psychologist more than doubles to 1526 to 1. And social worker increases tenfolds to 2106 to 1. For California, the student to staff ratios continue to increase, with counselor 626 to 1, for nurse 2,410 to 1, for school psychologist 1,441 to 1, and for school social worker an astounding 7,308 to 1. The state of California must treat child and adolescent mental health as a top priority and provide funding that enables schools to lower the PPS to student ratio to nationally recommended levels. Better academic outcomes for students, including improved attendance, fewer disciplinary incidents, and higher graduation rates in high poverty schools are prevalent when schools meet the recommendation student to counselor ratio. The maps displayed on the side show 38 states are shortchanging either students of color or students from low-income families, or both. Students of color and students from low-income families benefit the most from school counselors because they are at greater risk for developing mental health problems. Yet they are the least likely to receive these services. This color-coded map illustrates the inequalities and limited access to counselors present in 38 of our 50 states. We need to advocate for better than equal access and enough counselors. Of school-age children who receive behavioral and/or mental health services, 70 to 80% receive them at school. Utilizing schools as mental wellness centers will effectively provide resources to families who have limited access and also provide them with practical ways of preventing and addressing mental health issues. Possible research questions. The first research question that I came up with was, are students of color and students from low-income families most affected by high student-to-counselor ratio? The second research question is there a connection between meeting the recommended standard of PPS to student ratio with post-secondary education? Why are these findings important for counselors? These findings directly impact counselors and their ability to provide adequate services to students. Counselor recommendations. Counselors should advocate for recommended PPS to student ratio. They should utilize outside resources. They should establish connections to provide students with referrals when needed, and they should research the population they serve to better understand their students' specific needs. After going over all the slides, I would just like to summarize the information I just presented. It is important for us to understand mental health issues arising in youth. Counselors and other helping professionals in schools provide a vital source of resources, especially when it comes to low-income families and students of color. When the ratios for student to counselor or student to any PPS professional exceeds the recommendations set in place, it impacts students negatively. The second leading cause of death in youth is by way of suicide. The lack of mental health services in schools can have everlasting detrimental effects to the families in our communities. Student access to sufficient care when it comes to mental health should be uncompromisable. Instead, statistics show schools across our state and even the entire nation continuing to fall short when it comes to providing students with adequate support staff. These findings not only impact the students, but they also impact the counselors directly. By identifying these issues and continuing to research on the topic, we can attempt to bring much needed change. Thank you.